What if I told you that some of the very medical tests, routine annual screenings, and aggressive diagnostic checkups you have been faithfully attending every single year since turning 60 might actually be exposing your body to unnecessary surgical risks, cascading false alarms, dangerous radiation overexposure, and severe physical stress, doing far more harm to your health than good? What if the true, clinically proven medical reality behind modern preventative screening past age 60 is that overtesting often leads to a terrifying biological trap known as overdiagnosis and cascade treatment, where minor, completely harmless age-related body variations are treated with aggressive drugs, painful biopsies, and risky invasive procedures that destroy your quality of life? For millions of older adults over the age of 60 and 70, sitting in sterile clinical waiting rooms, undergoing endless lab work, and anxiously awaiting diagnostic reports has become an exhausting, nerve-wracking routine. You are taught from a very young age that more medical testing always equals better health, longer life, and absolute peace of mind. So every time your calendar flips, you dutifully line up for routine invasive imaging, aggressive chemical panels, and complex organ scans, believing you are taking proactive command of your longevity. Yet, after undergoing these routine procedures, you often find yourself caught in an agonizing web of clinical anxiety. A minor, harmless cyst is flagged on a scan. A baseline biomarker fluctuates slightly due to normal hydration changes. Suddenly, you are pushed down a terrifying pipeline of emergency follow-up scans, painful tissue biopsies, dangerous contrast dye injections, and heavy prescription drugs that leave you suffering from severe side effects, chronic digestive distress, and overwhelming anxiety, all for an isolated condition that would have never bothered or harmed you for the rest of your natural life. Your immediate instinct is to trust every automatic routine referral without question. But as a physician specializing in restorative medicine, clinical longevity, and conservative senior care, I am standing here today to completely challenge that passive narrative with absolute, unassailable medical evidence. True healthcare past age 60 is not about blindly ordering every diagnostic scan created by modern technology. True longevity requires wisdom, precise discrimination, and understanding the vital medical balance between genuine therapeutic benefit and clinical overtreatment. Every single medical intervention carries what we call a diagnostic risk ratio. When you are 25, your body rebounds effortlessly from invasive biopsies, heavy radiation exposure, or contrast dyes. But as you step past age 60, your kidney filtration rates change, your vascular walls become delicate, and your immune system requires stability. Unnecessary medical testing exposes your fragile physiology to severe biological disruption, subjecting you to unnecessary procedures that strip away your vitality, destroy your walking confidence, and ruin your golden years. Today, in this comprehensive, unified medical masterclass, we are going to tear down the walls of medical overtesting. We are going to isolate the exact 5 routine health checkups and screenings after 60 that often cause more harm than good, examine the underlying physiological dynamics of diagnostic cascades, and put a doctor-approved, safe health monitoring protocol into immediate action. I am going to reveal how your body's cellular sodium-potassium pumps regulate tissue health, detail a 5-move physical alignment protocol to maintain vitality right from home, and expose the exact organic plant compounds you need to introduce to nourish your body naturally. Before we uncover the profound medical realities of these 5 checkups you should rethink, if you want to shield your physical independence, avoid unnecessary medical harm, and secure your long-term longevity, please click that subscribe button below and turn on the notification bell so you never miss another senior health masterclass here on the Dr. Robert channel. To understand why certain routine checkups become dangerous past age 60, we must first analyze the exact trajectory of medical overdiagnosis that takes place under the surface of an aging frame. If you are completely ready to protect your body from unnecessary clinical harm, make smart health decisions, and lock in absolute longevity with me today, please type 1 in the comments section right now. If not, drop a 0 so I can learn exactly how to optimize these deep clinical masterclasses for your specific lifestyle goals. Let's look past the clinical waiting room and examine the raw physiology of diagnostic cascade trauma. When you subject an aging body to routine, low-yield diagnostic testing, you enter what modern clinical epidemiology calls the cascade effect. It begins with a high-sensitivity test that detects tiny, microscopic cellular variations, things like tiny benign nodules, harmless thyroid microcysts, or slow-growing, low-grade tissue changes that are completely normal markers of healthy aging. In a senior frame, these benign variations are extremely common and almost always remain completely dormant for decades without ever causing a single symptom or shortening your lifespan by a single day. However, once a diagnostic machine prints out an abnormal reading, standard medical protocols mandate a cascade of defensive follow-up actions. You are referred for high-dose contrast CT scans, invasive tissue needles, or exploratory scopes. This is where physical harm occurs. Contrast dyes used in advanced imaging can cause severe acute kidney stress in aging nephrons. Invasive biopsies carry high risks of localized bleeding, deep tissue infections, and severe nerve irritation. Furthermore, the extreme psychological stress of being told you might have a hidden disease triggers a massive, chronic surge of cortisol and adrenaline from your adrenal glands. This chemical wave constricts your peripheral arteries, spikes your baseline blood pressure, and starves your delicate brain and lower limb nerves of oxygen, causing real physical damage to your health while searching for a non-existent threat. Swallowing heavy drugs or consenting to invasive follow-up procedures for harmless, age-related variations is a profound biological mismatch. To truly protect your health after 60, we must shift from aggressive, low-yield overtesting to intelligent health monitoring. We must focus on functional vitality, maintain dynamic physical circulation through non-impact movements, and nourish our cellular pumps with clean, organic plant nutrition. Now, let us systematically break down the 5 health checkups you should avoid or thoroughly rethink after 60. Checkup 1. Routine annual electrocardiograms, EKGs, for low-risk, asymptomatic seniors. While an EKG is a vital emergency tool if you are actively experiencing acute chest pain, shortness of breath, or racing palpitations, ordering routine annual EKGs for healthy, asymptomatic seniors with zero cardiac symptoms frequently leads to unnecessary harm. As your heart ages, innocent electrical variations, harmless bundle branch blocks, or minor scar tissue from decades past naturally appear on the tracing. These harmless variations trigger emergency referrals for invasive cardiac catheterizations, stress tests with radioactive dyes, and risky arterial dye injections that carry real risks of arterial tears, kidney stress, and severe anxiety, all for an electrical variation that required zero treatment. Checkup 2. Routine prostate-specific antigen, PSA, screening in men over 70. PSA is an enzyme produced by the prostate, and levels naturally rise as men age due to simple benign prostate enlargement, BPH. In men past 70, routine PSA screening frequently detects extremely slow-growing, low-grade cellular changes that would never progress or cause harm during their natural lifetime. However, a high PSA reading often triggers painful transrectal prostate biopsies, which carry severe risks of systemic sepsis infection, severe urinary retention, structural nerve damage, and permanent incontinence. Leading urological guidelines worldwide strongly advise against routine PSA testing in older men without active urinary symptoms. Checkup 3. Routine urine cultures and antibiotic treatment for asymptomatic seniors. It is extremely common for older adults to have harmless bacteria residing quietly inside their bladder without causing any infection, inflammation, or symptoms. A completely benign condition known as asymptomatic bacteriuria. When routine urine tests are ordered without any burning, pain, or fever, These harmless bacteria are discovered and aggressively treated with strong, broad-spectrum antibiotics. This unnecessary antibiotic blast destroys your beneficial gut microbiome, causes severe chronic diarrhea, triggers dangerous C. difficile intestinal infections, and creates resistant superbug bacteria inside your system. Checkup 4. Routine screening mammograms for women over 75, with limited life expectancy or severe frailty. While mammography is a crucial tool for younger women, routine screening in women past age 75 with multiple underlying health conditions often leads to severe overdiagnosis. It frequently detects indolent, slow-growing microcalcifications or non-invasive lesions like dizziness that would never break out or cause physical symptoms. Treating these benign lesions leads to unnecessary surgical lumpectomies, disfiguring radiation therapy, and aggressive hormonal blockers that weaken bone density, cause severe joint pain, and strip away physical mobility during a senior's precious golden years. Checkup 5. Aggressive blood pressure and blood sugar screening, targets that push medications too low. While managing severe hypertension and uncontrolled diabetes is essential, routine clinical checkups that attempt to force an older adult's blood pressure down to strict youthful targets, like forcing systolic pressure below 120 millimeters mercury, or driving A1C below 6.5% using heavy pharmaceutical cocktails, cause immense clinical harm. Overtreating blood pressure in seniors causes severe orthostatic hypotension, sudden brain oxygen starvation, devastating dizziness, and catastrophic falls resulting in hip fractures. Overtreating blood sugar causes severe nighttime hypoglycemia, triggering cardiac arrhythmias and permanent cognitive decline. We have exposed the structural and diagnostic hazards of overtesting. Now, it is time to shift our focus from passive clinical screening to active physical preservation right here in the room. Instead of spending your days sitting in clinical waiting rooms, you must keep your lower limb hydraulic pumps active, your nerves decompressed, and your vascular highways wide open. Today, I am going to reveal our highly strategic, low-impact, 5-move at-home mechanical realignment protocol. These targeted movements are specifically engineered to bypass joint strain entirely, activate the massive muscular pumps embedded deep within your lower limbs, and safely decompress systemic vascular pressure. All you need is a firm kitchen chair, a clear wall, and less than 10 minutes of daily attention. Let us break down these 5 corrective movements with absolute clinical precision. Movement 1. The seated Soleus hydraulic second heart pump. This is our primary weapon to eliminate lower leg fluid stagnation and instantly activate the deepest circulatory engine in your lower limbs. The soleus muscle, located deep beneath your main calf muscle, contains a massive web of dense venous reservoirs that modern cardiology refers to as the second heart of the human body. Sit completely tall, right at the front edge of your firm kitchen chair. Do not lean your spine back against the comfortable cushioning. Hold your head high, roll your shoulders back, and pull your shoulder blades together to align your posture. Place your feet flat on the floor directly beneath your knees, keeping them perfectly hip-width apart and pointing straight ahead. Keeping the balls of your feet and all 10 of your toes completely glued flat to the ground, slowly and intentionally drive down through your midfoot to elevate both of your heels high into the air. Raise them up until you feel a deep, tight contraction locking along the lower half of your calves. Hold this peak contraction for 2 full seconds. Now, lower your heels back down over a 2-second count, touching the floor silently. The exact split second your heels touch, immediately peel your toes and the front of your feet up toward your shins, as high as humanly possible, locking the muscles along the front of your shins. The tibialis anterior. Hold for 2 seconds. Alternate back and forth continuously for 90 full seconds. Heels up, toes up. As you pump, imagine your calf acting like a mechanical sponge, forcefully wringing out stagnant blood and pushing it straight past your venous valves back up to your chest. Repeat for 3 total rounds daily. Movement 2. The countertop bamboo Achilles tensor. This movement targets the thick, rigid tendons running down the back of your lower ankle, which act like a physical constriction band that bottlenecks blood flow returning from your feet, driving up systemic arterial resistance. Stand completely tall and proud facing your kitchen counter, a solid table, or a flat wall. Place both of your hands flat on the surface at chest level to serve as your absolute balance security button. Step your right foot backward about 18 to 24 inches, keeping your left foot forward. Keeping your rear right heel completely glued flat into the floor and your right leg perfectly straight, slowly bend your front left knee and shift your entire torso forward toward the counter. Move forward until you feel a deep, intense, warm, lengthening stretch, stretching all the way down your right Achilles tendon and upper calf. Once you reach that point of deep stretch, do not bounce. Hold the position in absolute stillness. Take a deep 4-second breath in through your nose, expanding your stomach, and as you slowly exhale through pursed lips for 6 seconds, consciously imagine your tight ankle arteries softening and opening up. Hold for 30 continuous seconds per leg. Complete 2 rounds per side. Unlocking this ankle bottleneck instantly lowers the hydrostatic back pressure inside your arterial grid. Movement 3. The seated femoral highway unkinker. This movement is specifically designed to address the mechanical kinking that occurs inside your hip creases from spending long hours sitting in soft recliners, which completely shuts down blood velocity through your massive femoral lines and traps fluid away from your central circulation. Return to your tall, seated position at the front edge of your firm chair. Grip the metal or wooden side frames of the seat tightly with both hands to stabilize your pelvis. Keeping your posture long and your chest proud, slowly elevate your right knee upward toward the ceiling, about 4 to 6 inches clean off the ground, exactly like performing a slow-motion march. At the absolute peak of this movement, flex your foot by pulling your toes back toward your shin and hold your legs suspended in midair for 2 full seconds. Do not let your foot drop or slap back down unguided. Lower it down with immense control over a 3-second count, placing the sole flat on the floor like you are stepping onto thin ice. Immediately alternate to your left leg. Execute 10 slow, calculated marches per leg for 2 full sets. This rhythmic compression forces the massive, deep lymphatic and venous collection hubs inside your groin to pop open, clearing the fluid logjam. Movement 4. The lateral wall-supported pelvic brace. This exercise activates your outer hip stabilizers, specifically the gluteus medius, which control the alignment of your pelvis and prevent your body from swaying side to side. A primary trigger that causes your heart and nervous system to work overtime to stabilize your center of mass. Stand tall sideways, next to a flat wall or your kitchen counter. Place your inside hand firmly onto the surface for absolute balance protection. Stand with your feet pointing straight forward, touching each other, keeping your torso perfectly upright without tilting your shoulders. Slowly sweep your outside leg out sideways to the side about 12 inches. Keep your toes pointing straight ahead. Do not let your foot twist outward. Hold this lateral suspension for 1 full second at the peak, feeling the muscles on the side of your hip firing tightly. Slowly bring the leg back inward over a 2-second count until your feet touch. Complete 12 controlled lateral sweeps on one side. Then turn around to train the opposite leg. Perform 2 sets. Activating these lateral guards gives your body a rock-solid, stable foundation, drastically reducing the hidden sympathetic nervous stress that drives up baseline heart rate and blood pressure. Movement 5. The seated carotid carina deep diaphragmatic release. This final movement does not target your leg muscles. Instead, it directly targets your autonomic nervous system. It stimulates the specialized neurological pressure sensors located inside your neck arteries, known as baroreceptors, commanding your brain to instantly dial down its emergency adrenaline output. Sit completely relaxed but tall in your chair. Rest your hands flat on your lap with your palms facing upward. Close your eyes down completely. Rest the tip of your tongue gently against the roof of your mouth right behind your front teeth. Slowly inhale a deep breath in through your nose over a quiet 4-second count. Do not lift your shoulders or puff out your chest. Instead, drive the air deep down into your belly, forcing your abdomen to expand outward like a balloon. Hold that deep volume of air in your lungs for a brief 2-second pause. Now, open your lips slightly and slowly exhale that breath out through your mouth like you are blowing through a tiny straw. Extend this exhale over a slow, continuous 7-second count. As you empty your lungs, feel your shoulders drop and your entire nervous system down-regulate. Complete 8 continuous rhythmic breaths. Extending your exhale longer than your inhale activates your vagus nerve, sending an immediate chemical message down your spine to slow your heart rate, decrease systemic vascular resistance, and dilate your arteries. Our physical foundation is now completely secure, and our pathways are mechanically unkinked. Now, we must turn our attention to the biochemical matrix that works alongside our physical movements. To achieve long-lasting health restoration and avoid clinical overtreatment after age 60, you must complement your physical exercises with targeted nutritional activation. We need to introduce highly specific, nutrient-dense plant structures that function as direct cellular keys to balance your internal hydraulics, nourish your organs, and protect your home safety. Every single cell inside your body contains millions of tiny built-in structural engines, known as the sodium-potassium pump. Think of this pump exactly like a highly calibrated, two-sided swinging security door regulating your internal fluid pressure. When hidden industrial sodium accumulates from modern processed foods, it acts like a powerful biological sponge, drawing and holding immense volumes of water into the spaces surrounding your tissues, waterlogging your capillary beds, and driving up back pressure against your kidneys and heart. To reverse this fluid leak, your body desperately requires bioavailable organic potassium and specific vasodilating plant compounds. Potassium is the biological master key that swings the cell door open, pulling water back inside the cell where it belongs, and sending a direct chemical signal to your kidneys to flush the excess, stagnant fluid out into your urine. Vegetable Code 1, mustard greens, gaibasan, and the glucosinolate renal reset. Mustard greens contain an elite concentration of glucosinolates and bioavailable organic potassium, combined with a massive dose of vitamin K. The unique glucosinolates and sulfur compounds that give mustard greens their sharp, slightly bitter taste act directly as a natural, non-chemical stimulant for your liver and kidney filtration pathways. It actively prompts your renal system to clear excess extracellular sodium reservoirs, forcing trapped fluid back into your main circulatory highways without the need for harsh pharmaceutical diuretics. Integrate 1 cup of gently steamed or blanched mustard greens into your diet 3 times a week. Vegetable Code 2. Crisp organic celery and the thalide muscle reset. Celery stores an exceptionally rare, highly active organic chemical compound known as thalides. The specialized thalides inside celery act directly on the smooth muscle tissue lining the middle layer of your artery walls. Thalides work by gently blocking the influx of calcium into the muscle cells, which prevents them from cramping and constricting. This action forces your tense, narrow blood vessels to smoothly widen and relax. Aim to consume 2 to 3 raw, organic celery stalks every single morning. Vegetable Code 3. The organic crimson beet and the deep hydrostatic flush. The deep red beet is a legendary vascular therapy asset, packed with an incredibly high concentration of inorganic dietary nitrates. The exact moment you digest beets, your body converts these nitrates into pure nitric oxide, NO, the master key that commands the smooth muscles around your leg veins to open and relax. This removes the mechanical vascular roadblock, allowing stagnant blood to travel back up your body effortlessly and nourishing your organ tissue. Enjoy half a cup of roasted or gently steamed beets with your evening meal. Furthermore, we must bridge the gap between nutrition and your actual 24-hour daily living environment. Longevity and perfect health stability are quietly constructed out of safe, repeatable daily lifestyle defenses. To eliminate the high risk of a sudden morning pressure spike or orthostatic fall when stepping out of bed, you must implement the 5-second transition rule the very moment your eyes open. Step 1. The lateral awakening. When you first wake up, do not immediately sit up. Remain flat on your mattress, roll gently onto your left side, and take 3 deep, slow abdominal breaths to allow your baseline heart rate to stabilize. Step 2. The seated equalizer. Slowly push your upper body up and sit completely upright on the absolute edge of your bed frame, allowing your feet to hang down flat toward the floor. Count to 5 slowly in your mind. This 5-second pause gives the specialized pressure sensors inside your neck arteries the exact time window they need to adjust your blood vessel tension against the downward pull of gravity, completely preventing sudden dizziness, blurry vision, and morning falls. Step 3. The priming pump. While sitting on the edge of the bed during those 5 seconds, perform 10 quick, rhythmic ankle pumps, peeling your heels up and your toes up. This immediately fires your second heart calf engine, driving fresh blood straight back up to your skull before you stand up. While implementing these powerful natural habits and avoiding unnecessary health screenings will drastically improve your quality of life, true medical wisdom requires you to maintain an absolute baseline of diagnostic awareness. You must completely memorize these non-negotiable emergency markers. If you ever experience any of these acute symptoms, stop all activity immediately and seek emergency medical evaluation right away. 1. The asymmetrical leg flush. If you notice a sudden rapid increase in swelling that is strictly localized to just one single lower leg or bap chun, accompanied by intense, throbbing pain, deep redness, or skin that feels unusually hot to your touch. This is a classic clinical indicator of a deep vein thrombosis, DVT, a dangerous blood clot trapped inside your veins that requires immediate medical emergency intervention. 2. The ischemic chest vise. Any sudden sensation of heavy pressure, squeezing, tightness, or a crushing ache localized deep behind your breastbone, especially if that pain begins to radiate outward down your left arm or up into your jawline, accompanied by an unexpected cold sweat. 3. The neurological switch. The sudden onset of intense, room-spinning dizziness, a sudden numbness or loss of motor control localized to one single side of your face or body, or sudden difficulty speaking. These are the definitive warning signs of an acute stroke. As a final critical physician's warning on active lifestyle adjustments and nutrition, because vegetables like mustard greens are exceptionally rich in bioavailable vitamin K, you must exercise high precision if you are currently prescribed traditional blood-thinning medications, such as warfarin or Coumadin. Do not make sudden, drastic spikes or drops in your daily consumption of greens, as it can alter your clotting times. Maintain absolute consistency and always consult your primary care physician to tailor your monitoring to your healthy, nutrient-dense lifestyle. Living your retirement with true dignity, supreme physical freedom, and absolute peace of mind means taking total command of your daily biological choices. By making smart, informed decisions about medical testing, protecting your vascular endothelium, and keeping your internal pumps active, you are securing the freedom and longevity you rightfully deserve. Please take a brief moment right now to comment below with your current age and share which room in your home you are going to audit for loose throw rugs or safety lighting first today. Click that like button, share this vital guide with a contemporary who is struggling with medical overtesting or chronic clinical anxiety, and subscribe to Dr. Robert to safeguard your longevity journey. Thank you so much for watching. Keep your foundation strong daily, and I will see you in our next video.